All right, let's get right into it. We're going to talk about local anesthetic calculations, which I know is a topic that probably gives a lot of you studying for the AFK exam a little bit of anxiety. But don't worry, we're going to break it down.
And look, it's totally understandable to feel that way. If we're being honest, most of us got into dentistry because we love working with our hands and helping people, right? Not because we wanted to do a ton of math. So when you see one of those calculation questions pop up, your heart might skip a beat. But here's the thing, you don't need to panic. Because what if I told you the key to solving most of these questions isn't about being a math genius? What if it's actually about being a good detective? It's about learning to classify the patient and the scenario. It really is more of a logic puzzle than a tricky math problem.
So here's how we're going to do it. First, we'll bust the calculation myth. Then we'll cover the 3 essential safety keys. After that, we'll decode what's actually in a carpule. Then comes the core of our strategy, the 4 patient scenarios. We'll also hit on some critical contraindications and wrap it all up with a simple exam-ready algorithm you can take with you.
Okay, so let's tackle this calculation myth head on. The biggest secret is that for the most common patient you'll see on an exam, a healthy adult over, say, 150 pounds or about 70 kilos, you're not really calculating anything. You're just supplying the known absolute maximum dose for that drug. The hard math has already been figured out for you.
Now, before we jump into any shortcuts, we have to get the fundamentals down cold. Every single decision you make about local anesthetic dosage, whether on the exam or in the clinic, boils down to 3 and only 3 crucial pieces of information. Nail these, and you're well on your way.
And here they are. First, you have to know the maximum recommended dose, the MRD, for whatever anesthetic you're using. Second, and this is a big one, you need the patient's medical history and any allergies. And third, of course, is the patient's weight in kilograms. These 3 things are the foundation for everything else we're about to do. All right, this next part is all about saving you precious time when that exam clock is ticking. Instead of trying to derive everything from scratch, we're just going to memorize a few key numbers. Knowing exactly how much anesthetic is in a standard 1.8 milliliter carpule is your first major shortcut.
And you know, this table looks simple, because it is. The math is easy. A 1% solution gives you 18 milligrams. So a 2% solution, like our good friend lidocaine, just double it. That's 36 milligrams. 4% articaine, double it again, 72 milligrams. You just need to commit these 4 numbers to memory. That's it.
We do the exact same thing for epinephrine. Your baseline to remember is that 1 to 100,000 has 180 micrograms. From there, you just follow the pattern. If you double the dilution to 1 to 200,000, you cut the epinephrine in half, down to 9 micrograms. If you make it more concentrated at 1 to 50,000, you double the amount to 36 micrograms. See the pattern? It's simple.
And this right here is the last set of numbers you need to memorize. These are your MRDs. Pay close attention to the absolute max dose column. See how articaine and lidocaine are both 7 milligrams per kilogram, with an absolute max of 500 milligrams? Those are the non-negotiable safety ceilings. Burn this table into your brain.
Okay, so you've memorized those key numbers. Now what? Now we put it all together. This is where the magic happens. Pretty much every exam question you'll face can be sorted into one of 4 buckets. Your only job is to figure out which bucket the patient belongs in, and that will point you straight to the correct answer.
So, scenario number 1. This is your bread and butter, the most common type of question. You've got a healthy adult, they weigh more than 66 kilos, or about 150 pounds, and they have no medical issues. For this patient, you can put the calculator away.
Exactly. For this patient, you just use the absolute maximum dose from that table we just looked at. So for lidocaine, that's 500 milligrams. Then all you have to do is divide that 500 milligrams by the amount per carpule, which is 36, and you get your maximum number of carpules. It's just one simple division, not some long, complicated formula.
Okay, on to scenario number 2. The second you read the words cardiac patient or significant cardiovascular disease in a question, a big red light should go off in your head. For this patient, their medical history becomes the #1 priority, even more important than their weight. And that brings us to a super important concept, the limiting factor. This just means which drug are you going to max out on first, the anesthetic or the epinephrine? Well, for a cardiac patient, the answer is always the epinephrine. You'll hit the safe limit for epinephrine way before you get anywhere close to the limit for the lidocaine itself. And because epinephrine is our limiting factor, we have some very clear, simple rules. The max epidose for these patients is around 40 micrograms. So what does that mean for you? It means 1 carpool of 1 to 50,000 epi, or 2 carpools of 1 to 100,000, or 4 carpools of 1 to 200,000. Again, no complex math needed, just memorizing these hard limits.
All right, scenario 3 is probably the easiest one of them all. If you see a question that mentions a patient has an allergy to bisulfites, you can stop right there. This is what we call an absolute contraindication.
And the answer is always 0. It's a trick question. But why? Well, bisulfites are the preservatives used in carpals that contain a vasoconstrictor, like epinephrine. So if a patient is allergic to bisulfites, you simply cannot give them any local anesthetic with a vasoconstrictor. The safe number of carpals is none. It's that simple.
And that brings us to our final scenario, number 4. Okay, deep breath, because this is the one time where you actually have to do the math. This rule applies to all pediatric patients and any adult who weighs less than that 66 kilogram threshold.
So for these patients, you can't use the absolute max dose because their body weight is the limiting factor. So you have to do 2 quick calculations. First, their maximum dose of the anesthetic based on their weight, and second, their maximum dose of the epinephrine. Whichever of those 2 numbers is smaller, that's your true limit, and that's your correct answer.
Now, outside of those 4 main scenarios, there are a few other critical medical conditions you need to have on your radar. The exam might throw these at you, and they directly impact which anesthetic you can or can't use.
So, for a true allergy, you avoid the whole class. If they're allergic to one amide, you don't use any amides. For atypical plasma cholinesterase, you want to be careful with esters. Methemoglobinemia? That's your key word for prilocaine. If a patient has significant liver or kidney problems, you need to reduce the dose of amides because that's where they're metabolized. And hyperthyroidism, you treat them just like a cardiac patient. Limit that epinephrine.
Okay, let's pull all of this together into one final, simple algorithm. Think of this as your mental checklist, your game plan for the second you see one of these questions on exam day. Here's how it works. Step 1, look at the medical history. Is it a cardiac patient or a bisulfite allergy? If it's a cardiac patient, bam, you jump to step 4 and use your memorized epi limits. If it's the allergy, bam, step 5. The answer is 0. If the medical history is clear, go to step 2. Check the weight. Is the patient under 66 kilos? If no, you've got a healthy adult. Step 3. Use the absolute max dose. If yes, they are under 66 kilos, then and only then do you go to step 6 and perform the full calculation. So at the end of the day, remember this. The AFK exam isn't trying to test if you're a mathematician. It's testing your clinical logic and your ability to keep patients safe. If you can master this process of classifying the patient first, you'll see that you barely need to do any complex calculations at all. Master the logic, not just the math. You can totally do this. You've got it.